Hello, I'm Dr. Nikita Deshmukh. Today I want to mention about sensory neural hearing loss. Now, we have seen a lot of cases of sensory neural hearing loss coming up to us, especially after the festival season. So, what we have seen is after loud sound exposure, such as loudspeakers or any kind of loud sounds, there is an effect definitely on the hearing. Nowadays, like everybody has online classes and work from home is going on, so excessive use of headphones is also happening, so that also has to be really looked at properly. Like you should try and minimize as much as loud exposure possible in order to avoid hearing loss. Apart from that, we also see that different kinds of noises which are related to construction, like if we are staying in an apartment, if there's any construction work, drilling work, hammering going on continuously, and that also can give rise to hearing loss. Basically, if a hearing more than 80 decibels is going to be continuously be around you, like maybe traffic noise or anything of that sort, that gives rise to something called as noise induced hearing loss. So in the higher frequencies, this kind of hearing loss happens, and what is most annoying is that because of high frequency loss, there's something called as ringing in the ears, tinnitus, which is a very disturbing symptom. And there is no much treatment for tinnitus, especially when you are in a silent environment. The tinnitus really haunts the person because that ringing is extremely annoying. So what you can do is, the most important thing is prevention. Prevention is always better than cure. So if you are knowing, you are anticipating that you are going to be exposed to loud sounds, what I would suggest is that you should use something called as ear muffs or ear plugs. That can definitely help in protecting you from noise induced hearing loss. There are so many industries also in which there is a lot of loud sound exposure, factory workers and all, so they are provided with ear muffs and ear plugs, and in fact in their cases annual screening is also carried out. So what I would recommend is that if you have symptoms of tinnitus, then you should definitely see an ENT and get your audiometry tested as well. Then there is also another entity called as sudden sensory neural hearing loss. In that, suddenly the hearing capacity of the ear comes down. There are a number of reasons for this. Viral infections. Sometimes it can happen because of trauma also, like post accidents and all that. Now there is treatment available only if the diagnosis happens within a week of sudden sensory neural hearing loss. So if you notice that there is a sudden decrease in the hearing capacity, you should not wait. You should immediately see the doctor.